Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, my dear students and colleagues, and welcome to this presentation in which we will give a brief overview about the general psychiatry. In this presentation, we will give an overview about the most common psychiatric disorder and their pharmacotherapeutic management, the most commonly used medications in the management of different psychiatric disorders, and the characteristics of safety and efficacy of these medications. I believe the most important in this chapter is the safety of the psychiatric medications, the safety profile, the adverse reaction, and the interactions. We will not go through a long introduction. Let's go directly to the agenda. Today, inshallah, we will provide an overview about schizophrenia, about major depressive disorder, bipolar disorder, and anxiety disorder, the nature of the disease, symptoms, diagnosis, and pharmacotherapeutic management. So let's start with schizophrenia. قناعة موجودة عند كتير من الناس لما نقول سكيزوفرينيا إنه ده شخص عنده شخصيتين متناقضتين أو متضادتين، وهذه القناعة غير صحيحة زي ما احنا هنشوف. المريض السكيزوفرينيا مش شخص بدبل بيرسوناليتي، لا، هو this is a patient with some kind of thought disorder. So it is a thought disorder that involves complex mix of symptoms, as we will see. And the etiology for this disorder is unknown, unfortunately. طبعا في كلام كتير انه role of genetics والhereditary والfamily history. It is really important, and from our clinical practice we see it repeatedly. لو حد من الفاميلي عنده psychiatric disorder, and specifically طبعا احنا بنتكلم عن schizophrenia, then the relatives will be more likely or on higher risk of having schizophrenia. So as we have said, the genetics, the role of genetics, and the altered neurotransmitters, and more specifically and most importantly the dopamine, as we will see, they have a significant role in the development of schizophrenia. However, we don't know exactly, as we have said, about the etiology of the disorder. طبعا الانست بتاع الديسوردر ده بيكون غالبا في مرحلة الشباب. يعني من الصعب ان احنا نلاقي حد سكيزوفرينيك فيرست دايجنوزد في السنين المتقدمة من العمر. في المن and the male gender, it is usually earlier compared to the women. يعني في الميلز بيبقى في بدايات العشرينات، بينما في الومن بيبقى في اواخر العشرينات او بداية الثلاثينات. وان كان نوعا ما الجندر ديستريبيوشن ما بين التو جندرز it is almost equal، بمعنى انه الريت او الانسيدنس متقارب جدا ما بين الميل والفيميل، مفيش هنا جندر رول. الانسيدنس في الجنرال بوبيوليشن حوالي 1% فقط، تمام، ولكن بالرغم من ذلك يعني it is really difficult to manage or challenging to manage, being زي ما احنا هنشوف non-curable disease. As we know انه due to the schizophrenia itself there is an increased risk of metabolic disorder، وكمان الانتي سايكوتكس وبالذات السكند جنريشن زي ما احنا هنشوف later on they have increased risk of metabolic disorder، تمام، وعليه فده بينعكس كمان على المورتاليتي. These patients have higher rate of mortality compared to the general population. بالإضافة إنه من الريسك فاكتورز اللي ممكن worsen symptoms أو يعني to be significantly impacting the development of these symptoms is the poor lifestyle, the social isolation, and tobacco smoking. تمام. دول، وهنا مش هنقول substance abuse لأن substance abuse one of the differential diagnosis مع السكيزوفرينيا. لازم نتأكد ان البيشنت اللي عندي لما اجي اخد الهيستوري ما بياخدش اي نوع من انواع المخدرات او ما شابه ذلك، لان دي ممكن تعمل drug induced psychosis which could be very similar in the symptoms with schizophrenia. So we are focusing mainly on the tobacco smoking, لان substances or narcotics they have a different chapter in psychiatry. By this we conclude the first part. Let's proceed to the second part, and thank you so much.